Welcome, everyone. Hey, we're bringing you all things beauty to help you get your shine on. First up, could a new treatment send dark under-eye bags packing? Our investigative producer, Leslie Marcus, is backstage testing out a new procedure with board-certified dermatologist Dr. Azadeh Shirazi. So, Leslie, what is going on back there?
I'm back here with Dr. Ozzy and her patient Homa, and we're going to try out a procedure that Dr. Ozzy actually created called Eyeglow. Homa, what do you dislike about your under eyes?
I have struggled with dark circles for years, and I've tried so many products, and nothing really works.
So, Dr. Ozzy, how does this procedure actually work?
Well, as you can see, the hollowness under her eyes creates a shadow, and that contributes to the dark circles. Many times, hyaluronic acid fillers, they're clear, as you can see. If they're placed under the eye, they can cause a bluish hue, kind of like how the sky is blue. That's called the Tyndall effect. So what's unique with Eyeglow is that I mix in a little bit of calcium hydroxyapatite, and it creates a white, opaque product that helps brighten the under eyes, similar to like how a concealer would when you apply it under the eyes. And so that's what's unique about the Eyeglow procedure here. And she's been numbing with these patches. So we're going to take the patches off.
So we're going to start.
We're going to start.
Dr. Shirazi, it's Dr. Ordon. I'm sorry to interrupt. Hopefully you can talk and inject at the same time. But
Absolutely.
The question is, I saw you mixing your radius. Now, is your radius mixed with lidocaine, or is it being mixed with hyaluronic acid as well?
It is mixed with hyaluronic acid. So I just have just a little bit of radius just to give it that white, milky appearance. So I've mixed it, and I'm going to use my introducer here going in.
So you're using a cannula, correct?
I'm going to use a cannula, but in order to get the cannula in the skin, I'm going to
And just for our audience, a cannula is just a thin tube that's blunt at the end. It's a little different than a needle, and that way it's less likely to puncture a blood vessel.
How is that feeling? Do you feel that at all, Homa?
No, the numbness is pretty good.
So we are actually injecting from the cheek to get into the under eye. And you can kind of see I'm right here.
So you're very deep. You're like right on top of the bone.
Very deep. We're right on periosteum.
And why do you want to go so deep with this?
Because really, I want to lift the entire tissue. And if you inject this too superficial, what can happen is you can get a little bit of a ridge.
And that can really show up when you're smiling.
That's right. That's right. You turn just a little bit.
And I completely agree that the technique right on bone is absolutely the best way to go in that location in the tear trough. But I like the innovation of offsetting some of the hue of the hyaluronic acid filler. I do want to point out to our audience and our viewers that adding in a non-dissolvable filler like the calcium hydroxyapatite does increase the risk a little bit. So if you are considering something like this, you have to be exquisitely careful with who does it, because that filler in a blood vessel can have a devastating outcome of blindness. So you just have to be really, really meticulous and cautious about who does this for you.
Such an important point that it is technique sensitive. You want to have an injector that really does this all the time, understands the anatomy.